Great. Good evening, everyone. Welcome to the February 16th regular business board meeting of the Lower Merion Board of School Directors. This meeting is being made publicly accessible via Zoom and also being live streamed. There will be an opportunity for public comment regarding any topic during this meeting via the chat feature, which will be open during audience recognition and will be read by the district solicitor. This meeting is being video recorded with sound for purposes of public broadcast. All participants are muted upon entry. We're going to start this evening's meeting with a presentation on the reopening and also a update from the policy lab. I'm going to turn it over to Mr. Copeland.
Thank you, Mrs. Klein. Just a quick update, and then I'm going to let Megan take you through some specifics. And we're waiting for Dr. Rubin to come. So what we plan to do is just to take you through where we are since last week, and Dr. Rubin will take us through any updates that he has on guidance from CHOP when he's able to join us. The board will have an opportunity to ask Dr. Rubin questions and engage, as well as, of course, with Megan and myself, and then we'll go to audience participation. Just as a general overview of where we are. This evening, a survey was to go out. There had to be some debugging of the survey, but the survey that's going to go out tonight has a return date of February 21st. Our intent is, this is not something where we're asking folks to sign up to say, here's where we want to be. It's really to take the temperature of the district at this time in terms of a full return. So that should be going out almost as we speak. I'm told by 8 o'clock. And then we'll take the week of February 21st to analyze the results, begin to implement program adaptations that we need to do. And eventually that week or sometime during that week, we will have some other information sessions. They'll almost have to be school by school so that you'll have an opportunity to know exactly how your school is being set up. And then we will ask for a commitment to pathways going forward. And then the week of March 15th, finalize plans to return in accordance with those pathway options, and then eventually put everything in place for in and around the time of spring break. And that's the target that we're looking for. So with that, I'm going to ask Megan to just bring us to what new information we have.
Good evening, everyone. I'm going to, as Mr. Copeland said, talk a little bit about some things that we discussed last week, but also give you an update. And probably one of the more significant things that has happened since we were last together is that the guidance, the CDC issued guidance on Friday that many districts and others watching were anticipating. I think overall the good news is that there really weren't any surprises, and it reinforced all of the practices that I think we've put in place and are continuing to scale up so that we can plan for the safest return possible for students. So I think there's a lot of good news there from my standpoint. And in addition to kind of looking at that a little bit closer and giving you our lens on that new information, also just give you an update of where we are with those steps moving forward. As Mr. Copeland mentioned, one of those steps was to get a family survey out. I'd also note that we are going to be issuing a staff survey this week as well. So the last time we talked a little bit about this particular graphic, just to reiterate, the district works closely with the Montgomery County Intermediate Unit and all of the districts affiliated with that, which are all the districts in Montgomery County, as well as the Office of Public Health. We look at guidance issued by all of these government entities, as well as we are attentive to the research that's out there, not only that's issued by the CHOP Policy Lab, but also has has been cited, the Harvard, Brown studies, et cetera. So those are all things that come to our attention and that we review as a reopening committee, as a health and safety committee, and so forth. So as I said, tonight we're going to focus a little bit on that new CDC guidance, just to try to make sure we're all on the same page and answer questions to the extent we're able to, knowing that we're not public health experts, although one may be joining us here shortly, but we'll try to give you an update as it relates to the work that we are doing. Again, the good news is that it reinforced the guidance that we've already been following: the use of masks, the physical distancing, the hand washing, cleaning, and the contact tracing, which, as I've mentioned before, that's largely done by the school district at this point when the case involves a staff or a student, so that we do have staff designated for those purposes and working closely with the Department of Health in doing so. They did, I think the CDC did emphasize that the masking and physical distancing were sort of priority mitigation strategies. And again, ones that we will continue to look at closely as we move forward with our planning. I think we feel good about masking compliance here in the district. I think that's something we can be proud of, and I think we've done well in that area, and same with the distancing. The other prevention strategies of note, I think somewhat of a surprise to me, but also puts us in a good position, is that the focus on the testing as an additional strategy, which, as we've mentioned, the district has positioned itself to provide testing not only to staff, but also to moving forward to possibly expand that to students. We've been informed that we would be able to get the supply to do that, and we are working to build out our infrastructure in order to be able to meet that demand of testing upwards of 1,000 plus students, in addition to 1,000 plus staff members. So that's something we are continuing to work on. And vaccinations, as we've talked about, and I know this is a national concern, the supply being low, but something that is, we're optimistic that is going to be changing. We really do want to see our staff that would be in that 1A category get vaccinated as soon as possible. So that is a priority for us, and we are working to make sure that we're continuing to work and try to partner with providers that will be able to do that for us in the near future. I'm sorry, I moved on too quickly there. In addition to those key mitigation strategies, another takeaway from the updated guidance is their sort of continued look at community transmission as an indicator of what level of instruction would be appropriate. So the indicators that they focus on is the number of new cases per 100,000 persons in the past 7 days, as well as the test positivity rate over a 7-day period. So those two factors are linked to this table that you can find in the guidance, and each one of these, I think, slides has the citation from the CDC website. One of the things of note that I was curious about when I started looking at this is what happens if those two indicators land in different transmission zones, so to speak. So you see those colors of blue, yellow, orange, and red indicating anywhere from low to high transmission. And then on the left-hand column here, the indicator, whether it's the number of new cases or the test positivity rate, those being separate rows. So that little footnote number 1 there, which is in the small print, I tried to make it larger for the purposes of this presentation, but what it says is that if two indicators are in different levels, then the action is supposed to correspond with the higher threshold. So for example, as you'll see in a minute, I'll go over some of the local data, but the new cases for the Lower Marion specifically would put us in the red or high transmission, whereas the positivity rate would put us in the, I believe, the yellow or moderate. So if, adhering to the CDC guidance would indicate that we should be following the guidance that is attached to that high transmission or red indicator. So again, as I mentioned, those transmission rates are tied to their recommended learning modes. The CDC, though, does reinforce that at any level, it is possible to provide in-person options, whether they be hybrid or fully in-person. And as we look at this, as those transmissions gets translated into learning modes, if we just look at high, for instance, while it says that elementary should be in hybrid and middle and high school should be virtual, it does indicate that if we are already in a hybrid model, as we are, that we could continue to do that, provided that the mitigation strategies are adhered to. I think one of the, probably the controversial pieces that we're well aware of is the question mark around what's the distancing requirement. And the CDC is saying that if you're in the orange or red transmission states, that you should, that 6 feet is required for distancing. Whereas if you're in the blue or yellow transmission rates, that would be, it would be advised that you maintain the 6-foot distance to the greatest extent possible. So I'm just relaying to you what that guidance says, because I know there's been some question about that, and that's how we read that as a district. That being said, we feel that we have a lot of good mitigation plans in place that allow us to move forward. Similarly, I think the good news is while this is from yesterday, the Montgomery County Office of Public Health website, I pulled this data specifically for Lower Marion and Narberth that gives you those case numbers, which is what I indicated puts us in that red zone for the number of cases, because it's above 100 per 100,000. At Lower Marion, obviously Narberth is a little bit higher. You can see it spiked there right most recently for Narberth in particular. Similarly, the positivity rates, as I mentioned, for Lower Marion is at 3.43%, which actually does put us, I'm sorry, I misspoke earlier and said the yellow zone. It should be the blue zone, as Narberth, it would put us in the yellow zone. So that's where we are. The good news, as I shared last week, we're seeing a decline. We're seeing a decline, and we're anticipating, continuing decline into the warmer weather. And today was a nice example of what we might be looking forward to sooner rather than later, but that we'll continue to see a decline that, even adhering strictly to the CDC guidance, that we would be perhaps safely in that yellow zone that would allow for that relaxation of those distancing requirements in the near future. I showed this last time, and I just thought it would be helpful for the board to just have this visual again. As you can see, that blue band across the schools, we still have a large portion of our students that are in the hybrid program that, as we think about full reopening, how do we accommodate all of those students that are still with us in a hybrid model? Again, the impact of flex, you see that a little bit more. That's a green bar at the middle school level, but it doesn't really, the theory is that we'll have more kids out. It doesn't make a great impact. Obviously, we're looking forward to seeing the results of the survey to get some better numbers on where we are with that. This timeline we looked at a little bit the last time. We've had students in person since September. We continue to follow guidelines at both the state level. That attestation form is still out there that we've signed, and we need to continue to make sure that we're adhering to that. We have, increased the number of students that are in person either 4 or 5 days a week based on needs. We have a special education population that's in. We have kindergartners that are in full time as full time as a part time program, but we are continuing to add students to that population. We're continuing with our testing efforts, as I mentioned before. We're still in that winter flex option period of time, so we're seeing that is serving a benefit to our families as well, who we're looking for a fully remote option. And finally, these are the areas that we're still exploring, we're working on, and we'll be able to fine tune as we get the data back from the survey, as Mr. Copeland mentioned. I will note that we met with a family focus group on Friday that helped us with the development of that survey, so we're grateful for their time in putting that together. So with that, I will
Thank you.
turn it back over to Mr. Copeland.
So before I open it up to questions for Megan, I see that Dr. Rubin is here. Thank you for joining us, Dr. Rubin. As we indicated, we're full ahead. We think that the ability to use flex space outside, the ability to keep our testing program going, the mitigation tools that we've used, the air quality tools that we've used, puts us in a good position for an opening. Dr. Rubin, I wonder if you could share with us where the guidance and the thoughts are from the Children's Hospital and your policy lab.
Sure, absolutely. I mean, obviously, the CDC guidelines are in everyone's minds this week. I know there's a lot already being written about those guidelines. Our team actually felt like they kind of rode the middle pretty well with those guidelines, and reviewed the evolution of what we know about this virus over time as it pertains to kids and schools in particular. And I think some of the key takeaways, like, the thresholds to me are meant to be lane markers. I mean, you're trying to provide guidance to CDC for many, many districts, from large urban districts down to suburban districts, rural communities as well too. I don't view them as these are absolute thresholds, but there's important notes there. First is the recognition of patience as you make the changes to resume full instruction for groups of students. You have declining transmission that is hopefully going to continue over the next few weeks. But to be patient, to allow that process and that decay of community incidents to occur, and just plan ahead. I think you can sufficiently plan around changes, particularly in your elementary schools, to get back to full instruction. Given what we know and how well these multi-layered safety protocols have worked. I think that CDC emphasized the ideas of that masking and distancing and hygiene and sick policies are extremely important. But they also gave you the lane to say 6 feet to the greatest extent possible. Now, my interpretation of that language as case incidence drops is that the goal is to get more kids back in the classroom, but you want to preserve 6 feet as much as possible. That's based on the knowledge of this virus and its transmission as a respiratory virus. There's still a lot we don't, there's still a missing data point in terms of how much the mask actually protects in close proximity, particularly when there's high case transmission in the community. But to the greatest extent possible means use your outdoor space. Find the moments when you absolutely can and need to preserve 6 feet, like in the lunchroom when kids are eating. Reduce it when you can. Reduce sustained exposure. Use potting, if you will, to help you within classrooms, particularly if quarantine decisions need to be made as you move forward. So I did like the way they kind of acknowledged that the lane that's needed to get more kids back into the classroom with falling transmission. I think there were very sensible approaches in there with regards to sports, with the use of testing, I think was affirmed. I think testing is a real advantage that Lower Merion now has with its weekly assurance testing. Your rates as a municipality tend to beat the rates in Montgomery County. We're seeing extremely low rates of positivity. We're picking up some contagious individuals. We're removing them from the school. But as we add that additional assurance testing to kids, particularly high-risk athletes, kids in the music and arts, we can also plan for prom, for graduation, and those types of things. It's just a nice additional tool. And then, eventually we'll be adding vaccination, which the CDC recognizes, like we do at CHOP, that we have seen sufficient evidence that schools can operate safely, that vaccination itself is not a precondition to the types of moves you might be making if case incidence continues to drop as quickly as we've seen in recent weeks. So, I can answer some questions, but I think our feeling is that we're in a very different place. We made very difficult recommendations at the end of November. Lower Merion itself has experience with LinkedIn school transmission and understood what that felt like back in November and December. But we're in a different place right now, and many schools have done well and continue to do well, even at these higher periods of incidence, through emphasis on their protocols. And with the rates as they currently are, and with a strong seasonal, you're really seeing the seasonality of this virus right now. And I suspect, even with concerns of variant strains out there, we're just not seeing it in the numbers, and we're seeing declining transmission across the entire country now. And we're also seeing it across Europe. And so, and I don't think it's just simply a product of lockdowns or behavior that people have. I think we're seeing a natural trend emerge as we have immunity from natural infection and acquired immunity from vaccination. That's also helping here. There's just a lot of environmental and behavioral factors that I believe are overcoming any sort of proclivity of new strains to potentially take hold here in spring, like they took hold in Europe over November, December.
Thank you, Dr. Rubin. This is Klein. Rubin, your question?
Great. We have a couple of questions. Dr. Gilbert?
Thank you very much. And Dr. Rubin, thank you for all of your assistance since March. It's been, as I know you're aware, it's been very, very difficult for school boards and administrations to make decisions, because we're obviously not public health experts. And I think it's been hard for some of the public health experts, because I think it's been difficult to sort of know what it actually looks like in school situations. So one of my concerns is that Lower Merion, which this is sounding like there's very good news coming, which I'm thrilled about. Lower Merion has a very large student population. We have one of the highest, fastest growing school districts in the state, if not the fastest. And, our buildings have been pretty packed, which is why we're building a new middle school. And it's why we added on at Penn Valley and Gladwin and Welsh Valley. And we did a lot of other work on the interior of schools. So in terms of this we hear people saying to us, you should just use 3 feet. And I hear you saying do 6 feet to the extent possible. But you made it, it sounded to me like you were saying when you can use your outside, when we're able to use the outside, which would allow us potentially to stay closer to 6 feet. Is that accurate? I mean, I'm assuming.
Well, I'm also timing this with declining transmission. If you remember, but going back to the fall, I had talked about what the different incidence levels as you fall, and I think Lower Merion's probably going to fall under 100 per 100,000 very soon in the next couple of weeks if these trends continue and things start to warm up. As you start to fall and you get back to levels like 50 to 75, you're talking about an approximate rate based on an asymptomatic rate of about 5 to 10 kids out of 1,000 who might be positive. So you just have fewer kids knocking at the door or staff knocking at the door who may be positive. And we're seeing such quickly falling transmission. I was on a call with Penn today. They had through one of their testing programs, no students that tested positive, and they're testing all their students every day. And I suspect that the risk that there will be a positive in the school is going to plummet. So that helps. And so when you're making that's the big differentiation here. And then you have the use of outdoor space and recognizing that you're just trying to do it to the greatest extent possible. But the combination of those two, along with the masking and the other protocols you've done, and the fact that you're doing an assurance testing program, should give you the confidence that things are going well. And you can certainly start with your elementary schools. I think the data is fairly persuasive about starting with your elementary schools, but I suspect we're going to see continued declines in incidents well into spring. And I would not rule out your middle and high schools in positioning testing to help you there and assure you that it's going well. It all comes down to like bolstering the other layers of your intervention. So outdoor space is one of them. The other is making sure that the masks are being worn effectively and that we're not having bandanas or gaiters moving around our high school. Like, there's really good instructional videos. I thought the CDC did a nice job emphasizing the appropriate fit of masks. And I would focus on those types of mitigation measures, particularly as you may forgive on a couple others.
I appreciate that. I'm still a little bit confused in terms of what you're saying about the distancing, because how I understood the CDC was that masks and distancing were the two most important.
Sure.
Um, and I've heard you folks talking about the different, sort of layers of protection. So at this point, given our amount of transmission, are you
I
saying that?
wouldn't tell you to do it. I wouldn't tell you to do it tomorrow, if that's what you're asking. I tend to.
Yeah, I am, because
Yeah,
I'd like to.
yeah, I wouldn't do it tomorrow. I think it's important. I agree with, as a parent in Lower Merion, I agree with the need to do a survey of your families. I mean, first identifying how dense your buildings will be if you move back to a plan makes some level of sense. But to me, I've always felt mid-March or April is going to be a
Okay.
time at which decisions can be made, and schools need to plan for that. I think starting with the survey and the things that you're doing, but I suspect we're still a few weeks away from making any bold changes to density. I think if you made any earlier changes, if things are moving quickly, you can start with your elementary grades. I mean, I think that's where the evidence would suggest greater safety. But I think it's appropriate to begin planning for the spring because I suspect that
Sure.
the trends are moving in your favor. But yeah, I'm not suggesting you make a quick move in terms of the 3 versus 6 feet. A lot has been written, and this is just my appraisal of 3 versus 6 feet. I think the background on respiratory viral transmission, particularly large droplet transmission, would suggest that 6 feet is appropriate. But it's obviously not accomplishable if we're intending to move back to full in-school instruction at some point. It still remains an area of controversy how much the mask preserves some level of protection under 6 feet. Now, with our testing program, you have an advantage to follow this closely. If there are students who are index cases in the school and kids need to be quarantined, you can test them out of quarantine at 7 days. You can do much more reliable measurement now to see, are we actually seeing any positives of the kids who are in quarantine? If you're seeing data that would suggest that it's posed too much risk in terms of positivity, then you have to address that. But if by a reasonable chance here now that if you start to see that kids, while wearing masks and doing it appropriately in school, are not having secondary infections from an index case, that's really important evidence because eventually we're going to have to accommodate to this virus. I think we're likely seeing, through natural or acquired immunity, both transmission go down. But there's going to be important evidence here is if this truly becomes an endemic virus, the people who have a second infection or might be exposed after they've had vaccination may have milder disease. And this will become more like a seasonal virus like influenza over time. And we're just taking the incremental steps, moving back to a full school day, really doing with good measurement, learning as we go and being prepared for data that might not confirm our hypotheses, but understanding that eventually even quarantine it will go away, and we may return to more of a state as we look forward to next fall, where the goal is not hybrid instruction, where it's full instruction, that we are going to follow case incidents closely and add back layers during periods of time, but we're learning to accommodate. And I think we're starting to think about those incremental measures that get us there.
Thank you very much. That really helps to clarify. And I think we're lucky in Lower Merion because our community has supported us in keeping our buildings modernized. And so we're in much better shape than many other districts. So I appreciate it.
Ms. Ackerman?
Hi, thank you. That's a good segue into my question. And thank you, Dr. Rubin. And I appreciate your interpretation of the guidance, because it sounds like the goal is to layer as many tools as you can to make school operate safely. And you're highlighting the number of tools we do have So the distancing, it has been somewhat controversial for the reason Melissa said. You can only fit so many kids in buildings, and that's the case at a lot of schools, but it sounds like with other measures, there's some flexibility there, especially with the use of outdoor space. But my question is, one, I think advantage we have, as Melissa alluded to, is we have modern, well-ventilated buildings, and the CDC really did not highlight that as one of their layers. And I think, you know, I think we have an advantage there as well. And so I just wanted to hear your thoughts on that, because it is actually an additional mitigation tool that we have. And I think the reasons the CDC did not mention it, which goes to the reality of a lot of schools and their desire to get kids back in school. But I just wanted to hear your thoughts on that. And thank you so much for working with us on the ACIT testing program. That's been amazing, and we feel very lucky to be a pilot, and hopefully a lot of other schools will be able to follow our lead. So thank you.
Yeah, you guys are no longer pilots. We're in full implementation, and we've got dozens of schools now that are moving in the same direction. But
Okay, that's great.
yeah, but I will say about the issue of ventilation, obviously it's been very controversial. I think it's an advantage that you have modernized buildings that you can circulate air, but I don't simply see the CDC guidance just as a forgiveness around ventilation because of many schools throughout the country that don't have the facilities that we have. I think it's more in recognition that, you know, if we're having a serious conversation, ventilation is important and is an adjunct, but is not a primary intervention for preventing COVID transmission. There have been anecdotal reports of aerosolized transmission, but they're few and far between. They can happen in confined spaces. But the secondary attack rates of this virus and the behavior of this virus, even with the variants, has suggested it's a large droplet transmission virus that's mostly spread in close proximity with sustained contact. So you have many buildings that have done, you know, very little changes to ventilation. We have a lot of growing experience with school buildings throughout the country. Even simple things just like cracking a window or keeping a door to a classroom open have been sufficient. We have not seen evidence of significant in-school transmission in those environments. And it gets back to the primary mode of spread, which is large droplet, which, you know, some level of diluting virus will help. But it's really about that close proximity, unmasked contact for sustained experience that drives those types of transmissions.
Thank you, Dr. Rubin. Mr. Driscoll?
Thank you, Ms. Klein. Again, Dr. Rubin, thank you for your time. I guess I'm my only question, not so much what we can do spacing within the school, because 900 square foot school room, you can do the math. I'm trying to get my head around, forgive me, our busing issue of typically we put 40, 50, 60 kids on a bus, drop them off, they go to school. Then at the end of the day, you put 40, 50 kids back on a bus and drop them off in the neighborhoods. And we simply do not have the bus infrastructure to do half of that. I'm very concerned. I just wonder if you would opine on it. Like, people are gonna say, well, put 40 kids on a bus, they're only on it for 20 minutes. What's the harm? But I don't know that that's quite the right answer. I don't know if you have any magic answers on this issue.
Well, that's where your sick policy still is in effect, and declining transmission helps you. I mean, like, you know, we've been forgiving some of the challenges on the bus since the fall. I mean, we still bus kids to school. It's important. I like to protect our bus drivers. I wanted to get our bus drivers vaccinated first because I recognize that that's one of the moments of transmission that's highest risk in in our schools. And so I've been advocating for transportation staff to go early once vaccinations are available, and to use, it's one of the unique situations where I've advocated potentially for use, whether you're going to double up masks or whether you're going to use a N95 masks, like to offer that opportunity to your transportation staff because of that moment. You can open windows on the bus, which will help. I think the warmer temperatures definitely are going to help in the springtime with regards to that, but that's where you got to really focus on effective use of mask wearing, and you might consider bus monitors or other methods to assure or assign seating as a way to pod kids. But again, if the rates fall to where I suspect they're going to fall in the spring, I think you're going to be in a place where the likelihood that there's an infected kid on the bus is going to be lower. And as long as kids are wearing their mask, you're going to be in a better position. So that's why declining transmission is a part of these guidelines. It's not so much the absolute rate as the recognition that you're declining. I think trends were not really emphasized, but these trends are steeply declining in most places right now, and that's an advantage.
Great, thank you.
Thank you. So I had a couple of questions following up on the point around masking. I know the CDC is recommending double masking, and I'm wondering, our health and safety plan doesn't really address the concept of double masking. And so is that something that you would recommend? And also, is that something even appropriate for kids? I didn't catch any nuance around double masking.
Yeah, so that nuance to me is a little bit too much. I think I would rather focus on the effective use of the masks that the kids are wearing. I would focus, if you wanted to make any intervention, it would be to use 3-ply surgical masks, which I've always favored since the onset of the pandemic. The ones with the wired nasal bridge are really good, particularly for people who wear glasses because they don't fog up your glasses. I think eyewear is a nice recommendation, particularly for your staff. I've always felt eyewear is important, whether it's goggles or glasses. As some teachers are wearing face shields, so that you have a variety of mechanisms to do that. When I'm in practice, I always wear goggles. It's just a second nature. But those 3-ply masks with the wired nasal bridge, there are ways to tie on the ends to make sure that they cover the sides of your face. I would focus on the effective use of masks rather than doubling up. I think that's more important.
Thank you. And I don't mean to belabor the point about the 3 feet versus the 6 feet, but when I'm thinking about the concept, 6 feet to the farthest extent possible, to me feels a little bit different than saying or knowing going in a classroom where a student is for a full day, especially elementary where they're not moving classrooms very much. It's not 6 feet, except for sometimes it would be, we are going in knowing that it's going to be 3 feet for that time period. And I'm wondering if that is the same or if that's sort of a nuance on 6 feet versus 3 feet.
Not elementary school kids for me, because we've seen lower rates of the younger kids have been inefficient drivers. They're cohorted, like you said, during the day. That's also an advantage. They're not moving around from class to class to spread. They're also not in travel sports, which frankly have been a real challenge. I mean, the activities and the social mobility that kids have in the community, it's a little bit less with the younger kids, and we've seen less susceptibility to infection in general in the younger kids to begin with. So you have some advantages there from what we've observed about the virus itself. But so I feel like, if anything, I feel the strongest data has been the safety of elementary school classrooms through the pandemic, even at higher rates of case transmission. So I think you have the entirety of the data to weigh, and I recognize that means they'll spend more time in the class, but the young kids wear those masks pretty well, and they tend, and they don't move around as much, and I think that's an advantage.
And for the older students, that sort of knowing that you're going into a classroom that will have 3 feet.
Well, obviously that's why the middle and the high schools were separated out. I mean, I mean, every district, to me, the greatest extent possible recognizes I'm going to try to take advantage of everything I've got to do this. I think that, I want, that's why, keep getting high schools, back into full operations, whether you position testing or the declining transmission of spring, all of the above, the increasing vaccination of teachers as you go through the spring. I think you have a lot of things to weigh, but I also recognize that, we shouldn't forget about our middle and high school students, and each district is making its own decisions about the trade-offs of continuing to have kids remote and not being able to see each other. And I really feel optimistic enough about spring transmission, having observed rates out in the Midwest and elsewhere, that you're going to be in a very favorable position very quickly in spring here. And we're not just putting elementary schools on the table. We're talking about middle and high school as well too. And you just have to decide what your risk tolerance is, whether you remain hybrid with the middle and high schools for the rest of the year and resume full in the fall, when you have fuller vaccination of the population and likely when it's going to be offered to kids by then, or whether you want to make that move here in the springtime. And I think that people will be surprised potentially if the declines continue like we see now, that the rates will get low enough that you're not going to feel as risky about redensifying even middle and high school classrooms.
Thank you. Ms. Ackman?
Yeah, so just Dr. Rubin, I know there are some districts and schools in Montgomery and Bucks County in particular that are back 5 days who seem to be making it work with less than 6 feet. And so I just wanted to know if you've talked with them, because those are, you know, some operational examples, let alone some of the private schools that maybe we can learn from. So are there other mitigation strategies like plexiglass or things like that that can be incorporated when, you know, you're dealing with where you can't distance all the time, that you can recommend or you've seen or would highlight for us?
Yeah, well, a couple things. You got to remember that, if when you look at Bucks County, I'm not sure we have a complete picture of what's happened in Bucks County. I actually know about the positivity rates and some of the teacher testing that was done up there for symptomatic testing was pretty high, higher than people would imagine. I also know that Bucks County as a whole continues to have higher case incidence, has continued to have higher test positivity than any other county in the region. Now, whether you can lay that at schools, I think there were a lot of different things going on there, but I don't think we've had testing in place or the knowledge or real innate knowledge of just how much transmission has occurred in those schools. I think, there's been a lot talked about it, but the proof is in the pudding for me. And you have a county that has not done as well as the other counties in terms of preventing transmission. I also recognize that in Bucks, there are some schools that have achieved that, but most schools have been hybrid. And some schools did not open. So it's not a monolithic setting of everyone at 3 feet across the entire county. And I applaud them moving it further along. In Europe, in England, I think there was a lot of interest in 3 feet for a long time until they watched what happened with the variant strains in November and December. And I can tell you that the transmission in kids was extremely high and actually was a leading part of that wave. Now, it may not have come from schools, but it was sufficiently concerning that whether it was in school or whether it was outside of school, it was sufficiently concerning that the UK shut down its schools and have decided to keep those schools closed through March or April. And they were doing that based on their public health folks had regarding the concerns about transmission among youth during that time. Even some of the leading proponents around 3 feet actually walked back their comments during their time because they saw the same data in England. And so, that the issue of 3 to 6 feet remains controversial, particularly at moments of high case transmission. And that's the caveat, that most of the data we have goes through maybe November, really right at the time that the real surge began. I think, and if we're to trust that data, we would recognize that our best ability to incorporate distancing that's less than that 6 feet is during times when there's fewer cases knocking at the door. And I think that's what we're foreseeing is different. Now, to your second part of your question, which is to the issue of additional like plexiglass barriers. I like plexiglass when used, intentionally in the right moments. I think that, there is a question of how much it helps. It certainly helps in spaces in the school where there's high volume of people moving through, like reception areas, cafeterias. I think if you look at mass transit, they've used plexiglass as a way to help protect to even greater degrees bus drivers who are working there. I think lunchrooms might be a nice place to do it as well, because the masks are off at that point. Now, whether you add them in the classrooms and box kids in, I'm not sure whether that whether that helps keep kids confined or whether they're just leaning back in their chair or just takes away from the space you're doing. If you pod kids, you could potentially plexiglass between the pods, I suppose. I think that, you know, plexiglass barrier from the teachers, between the teachers and the children is an option. But again, we're moving into more speculative, like how much additional benefit does it provide? And I think it provides the most benefit when applied in situations where there's a lot of people moving through.
Dr. Rubin, one of the concerns we do have is our cafeterias and our lunch spaces. And we were debating plexiglass, and we were actually taking a look at the concept of a mask and a face shield where the child could pull the mask down and eat and have the face shield and be less, you know, bothered for the time that they were, you know, drinking or eating. Any thoughts on that?
For me, I'd try to preserve 6 feet if I could in the lunchroom and just let the kid eat, particularly at a moment of declining transmission. I think I think it makes some sense. I think it's a very creative thing. But again, I'm sensing a moment in the pandemic where we're beginning to accommodate and starting to draw back and focus on which layers I think are going to continue to be important and how we start to transition out of the pandemic. And when you make those moves, do them patiently. Um, don't do too many things at once. But also we're moving towards more normalization, and I suspect certainly by the fall we'll get there. But I think you have a lot of opportunity now to make some moves that kind of start to restore a little bit of normal over the next 4 months.
Mrs. Klein, I promised a certain time here for Dr. Rubin. Can we take Mr. Lee and Dr. Gilbert?
Yep. Mr. Lee, go right ahead.
Thank you. Dr. Rubin, thanks again for your time. I'm just curious if you put your fortune teller hat on, assuming the vaccine rollout continues and a significant portion of the population gets vaccinated, is it possible that in the fall we'll be able to reopen without masks, or should we plan on at least have contingency planning for opening in the fall with masks on?
I think it's a little too soon. I think there's some optimism that may actually happen. But here's the caveat: it all depends on where we are with case transmission this summer. I would not be surprised to see very little case transmission over the summer as this really retreats to more of an endemic virus. But if it does become as it becomes endemic, we would suspect it would return next fall. And I think that you may layer up. You may start a certain way, but if you start to see some case transmission, the first thing that'll return are masks and your sick policy. The last thing you're going to want to retreat on is your hybrid policy. And hopefully by then you're offering vaccinations to kids. Now, I don't suspect they're going to be required vaccinations anytime soon. But hopefully there'll be lots of participation, and that's also going to help over time as you do this. But to the degree that we have full coverage of the adults and we're seeing milder infections, either secondary infections or infections after vaccination in adults, and we're not seeing the severity that we were seeing over the last year, well, to me, that changes the calculus a lot. And that's what an endemic virus means. And we've always known that the kids are less susceptible to moderate or severe infection. It's a milder disease overall than influenza is, and we don't do all these interventions. And so we need to be cognizant of just, where are we with regards to the severity of this virus, the risk of hospitalization, risk of death, because that changes how aggressively we respond. But I still think that there may be time. We've learned a lot of great things when you might invoke testing in the fall or winter, how to use your sick policy, how to, not necessarily to quarantine all kids, but maybe kids who are, like they do in Japan, kids who are coughing or have, or don't have a fever, but are still coughing, may be asked to wear a mask during the day to protect others. I think there are smart, sensible things that will be silver linings from this pandemic that you might implement in a staged approach as you move towards winter next year.
Thank you.
And Dr. Gilbert, be our last question of the
actually,
evening.
it's related to what Dr. Rubin said. I'm wondering, do you have any sense, I'm just reading the papers, right? Like, do you have any sense when vaccinations might be available for particularly middle and high school kids, since that sounds like that's the you're less
Yeah, I
worried
think if
about
I'm
it.
reading that, they're doing the safety. So for they're doing the studies now of safety and dosing, and they're not looking for efficacy as much as they're looking to make sure they get the dose right, that you get the same immunologic response, that they see the kind of safety they want to see. I suspect that by the next school year, that the older kids for certain will be offered vaccination. We're starting to vaccinate select groups of adolescents with chronic conditions already at CHOP over the next couple weeks. And so I suspect that by the end of the summer, I think most adults, I mean, knock on wood, I think hopefully the vaccine supply is going to ramp up here. I think hopefully adults will have been offered, all adults who want the vaccine will be offered the vaccine by the summer, the end of the summer, and that many kids will as well. And we'll be vaccinating additional kids into the fall, and that will certainly be in your favor as we move into fall and winter next year. But I think the real question mark for me is I feel better, more optimistic. And again, I'm always watching rates closely. There is some question about the variant strains. I think that's why March, April gives you a few more weeks to kind of see whether observed trends continue. But I suspect this thing's going to get pretty quiet if I had to read the tea leaves today, as we move towards spring and into summer. And then the real question is, will it still remain as severe it's been? How high will the rates be next winter? And just planning for those how you might react under certain situations if we get there. But hopefully we'll be resuming at least full school operations. There may be questions by some folks, depending on the rates of vaccination in the community and the prevalence of virus, about the offering of virtual options for families who have individual special needs in the families. That may need to continue into next year. And some families have preferred virtual instruction. Some kids have learned better. We have to acknowledge there are some unique examples there. But yes, you may need to consider that as a board, even as you move with it on the principle and the likelihood that you'll be in a full school day, and we won't be talking about hybrid next year.
Okay, thank you very much.
Dr. Rubin, thank you very much.
Good luck, everyone. All right, see you.
Thank you so much.
All right.
Great. All right. Well, that was excellent. I thank you, Mr. Copeland, for organizing that with Dr. Rubin. I think at this point, we'll move on to the next part of our agenda, which is the committee meeting reports. And we will start with Mr. Mooring and the February 3rd Curriculum Committee meeting.
Great, thank you. The Curriculum Committee met on February 3rd at 8:30 a.m. via Zoom. The Curriculum Committee, there were 3 presentations, updates provided by the administration. The first on integrated math, year 2 update. Then we heard about the senior project update and part 2 of the update on student achievement data. The integrated math update presentation began with a reminder that the process is grounded in the district's strategic plan, using processes such as design thinking, problem solving, and systems thinking to develop solutions and understand the role of failure in learning, fostering a growth mindset at every level, and embed an inquiry-based approach across the curriculum. The process was initially launched in 2018-19 school year with selected integrated math units, and in the 2019-2020 year, we saw the introduction of new accelerated math course after Math 6. Math 7 was renamed to reflect the content of pre-algebra. Summer Math 8 was introduced as a summer acceleration option after Math 7, and Math 8 was aligned to Math 8 to 8th grade standards. And the integrated 1 was introduced to replace Algebra 1. In the 2020-2021 school year, integrated Math 2 was introduced to replace geometry, and we're on schedule to bring integrated 3 during the 2021-22 school year to replace Algebra 2. It was also noted that these changes were designed to address issues in 3 areas. The first being curriculum, noting that the previous sequence was not aligned to grade level standards. Also, the 8th grade students were being taught double content. And lastly, there was an issue around access and equity gap. The second area was assessment, particularly noting that the double testing at the middle schools with Keystone and PSSA. And the third area was around instruction and issues related to student engagement in mathematics. It was also shared that the integrated math model has shown promising results as observed in the Chapel Hill Carborough City School System, which has similar demographics to Lower Merion School District. They are the #1 ranked district in North Carolina. And they saw after 3 years of implementation, over 15% improvement in proficiency among economically disadvantaged students, over 10% improvement in proficiency among students with an IEP, and over 10% improvement in proficiency among African American students, and over 15% improvement in proficiency among English language learners. The integrated math program also allows for increased acceleration and credit recovery with the summer bridge options, with summer bridge 5, 6, and 8. There is also greater flexibility between the honors and the prep courses. We also heard some initial feedback from the pilot around improved student engagement, that it invites student inquiry and reduces the need for teacher-directed instruction. And it's also been noted that the students feel like they're applying mathematics, not just doing it. An examination of the integrated math scores from the beginning through mid-year assessment in 2019 to in 2020 to 2020-21 school year showed consistent improvement from module 2 through mid-year assessment in both integrated math 1 and integrated math 2 and 2 honors. The module 1 exam showed a very slight dip in both courses. We also reviewed the Desmos interactive online tool, which allows students to work on problems interactively and also provides graphing options which could alleviate the need for students to purchase the costly graphing calculator. Coming, as mentioned previously, coming in 21-22 will be the integrated math 3 and integrated math 3 honors. The senior project update. It was noted that the introduction and overview of the senior project was released on February 5th. The last day of classes for seniors will be May 7th. The experimentational learning phase will be from May 10th to May 28th. And final presentations will take place June 1st through the 7th. The changes this year in the process for 2020 to 2021 include reduction in mandatory experiential learning hours from 70 hours to 50 hours, increased flexibility in the terms of the types of projects due to limitations due to the pandemic, flexibility to presentations to either be face-to-face or over Zoom, and collapsed marking period rubrics to reflect current processes for continuous grading. The project examples include internship, a virtual or in person following safety protocols, service learning, again, virtual or in person following safety protocols, a service project, for example, developing a tutoring or after school program, or individual research that a student might use or approach. And the last presentation was around the student level data presentation. Dr. McGloin and Dr. Gaudioso shared an update of the student level data collected this year. They noted the types of formal and informal data collected and how they review that data and reviewed what they do with the data. I won't recount that here for the sake of time. And I also strongly encourage folks to access this presentation on board docs because it's a lot of rich information included there in each one includes a very detailed breakdown of our student performance in the following categories. Elementary math benchmark performance, grade 3 through 5 math unit test performance, the 2020-2021 middle school math cumulative assessment results, the 2020-2021 high school integrated math 1 and math 2 results, high school algebra 2 essentialized skill and or concept mastery, the high school algebra unit assessment results, elementary writing domains and rubric, elementary fall writing scores, writing domains and rubric, middle school fall writing scores, high school fall writing scores, elementary fall reading and benchmark grades, 1st through 5th, elementary fall reading record grades, 1st and 2nd, secondary fall TDAs, grades 6 through 8, middle school fall science cumulative assessment results, and the biology cumulative results. So again, there's a lot of very rich data there. It's too much to try and do in a verbal report, but I would definitely very much recommend people access that. And the next curriculum meeting will be held on March 3rd at 8:30 a.m. Thank you.
Thank you very much, Mr. Mooring. Next, Ms. Ackman, if you could provide the policy committee meeting report from February 5th.
The policy committee started with, we hosted Tara Doty from the ad hoc committee on equity and anti-racism to talk about how we could incorporate and actually operationalize that framework into our policy decision-making and discussion. And that was really helpful. And I see the committee and other committees of the board starting to do that. I think we'll continue to refine how we do that very visibly at the policy committee meeting. But I think it was very helpful for all of us. The meeting then moved on to, we didn't have any second readings. We're now reviewing an entire group of policies related to employment. And we're reviewing them all at once together strategically. And the administration is also working with the LMEA and looking at everything strategically as well. So it won't change how we do business, but it does give us an opportunity to take a fresh look at all of these policies and also apply an equity lens. We talked about how our new employment policies could support equity goals in hiring. And we're still, that language really still needs to come together. There is some language in the policies about kind of some safeguards around employment of relatives and how to prevent, I guess, traditional nepotism in terms of employment in the district. Which is one way to ensure equity. We also talked about retention and recruitment policies as a way to make it easier to hire teachers and staff. We discussed how the state has standards, but they've made it easier to hire on an emergency basis. And obviously this is top of mind for everyone in education right now due to the pandemic and needing substitutes and potentially needing additional teachers if we have to add additional classes for spacing reasons. We talked about revised orientation for new board members, including what needs to be included due to state mandates, and those are now specifically listed in administrative regulations. And another note on the hiring process, there's language in there making it very explicit that board members are not involved. There's a very hard line between the board and any employment, hiring, or practices at the district, and we'll obviously maintain and strengthen that. So we'll continue to discuss these at the next meeting, as well as some additional policies that we'll move on to, which is scheduled for March 5th. Thank you.
Thank you, Ms. Ackman. And back to you, Mr. Mooring, with an update from the Ad Hoc Committee for Equity and Anti-Racism.
Great, thank you. The Ad Hoc Committee on Equity and Anti-Racism met on February 10th, again via Zoom. The Ad Hoc Committee had two primary topics for discussion. In response to the feedback provided in our January discussion on hate speech, the administration provided an overview of the district's restorative practices. Mr. Johnson and Mr. Ross reviewed the district's approach. They noted that the fundamental premise of restorative practice is that people are happier, more cooperative, more productive, and more likely to make positive changes when those in authority do things with them rather than to them or for them. And that's a quote from Ted Wetchell from the International Institute of Restorative Practices. They began with a review of the 80-20 rule, which notes that 80% of restorative practice is intended to be done proactively. However, much of the discussion of restorative practice highlights processes after harm has occurred. They also reviewed the restorative practices continuum, which goes from informal, starting with effective statements and progressing to effective questions, small impromptu conference, group or circle, to the formal with a formal conference. For each level, some examples were provided, noting that effective statements are personal expressions of feelings in response to others' positive or negative behaviors. For instance, sharing how something made you feel versus an outward demand. Effective questions attempt to help those affected versus simply confronting challenging behavior. Instead of simply asking what happened, you might ask, what did you think when you realized what had happened? And noting around community circles that they allow they allow you to be both proactive and responsive. They give participants an opportunity to hear and be heard equally. Circles have multiple applications for both academic instruction and problem solving. The underlying premise of the concept of being restorative is that conflicts are best resolved by those directly involved in them. The intended result is improved relationships to minimize conflict, to mitigate the probability of repeat offenses, provide tools to better manage future conflicts, and support, not replace, disciplinary measures. Then we heard from Dr. McGloin and Dr. Paul, who provided an update on the equity audit process, noting that the Achievement Imperative Task Force's Equity and Inclusion Subcommittee has been charged with developing a plan around the equity audit process. They shared an update that since mid-December, the committee has expanded its members to round out the variety of perspectives, reviewed a number of potential equity tools, resources, and potential collaborators, determined that a collaborative process with an external consultant would be the most appropriate approach to allow for a fresh and objective perspective, and collected input from key stakeholder groups to narrow the focus of the plan. We reviewed the tools used by the subcommittee to gauge progress of the school system's equity work within 13 areas that were identified, including mission and vision, leadership, school board, resources and infrastructure, policies and planning, curriculum, pedagogy and instruction, professional development, staff diversity, data, accountability, community, and communications. The key informant groups included, but were not limited to, board directors, community members with deep connections to the community and demonstrated commitment to equity, school principals, and members of the superintendent's cabinet. There were a total of 58 people invited to participate, and 38 responded for a 66% response rate. The 4 top priority areas identified by the stakeholder groups are as follows: staff diversity, curriculum, professional development, and pedagogy and instruction. These would be the 4 areas that the group would consider engaging an outside consultant to help in the review process, while continuing to work on the remaining areas internally. The group then divided into small groups to answer the question: based on your view of the district, do these seem like the right places to start? There was a general consensus coming out of the breakout groups that these felt like they were the right areas. However, there was also agreement that the other areas were also important, particularly around communications and policies. The next meeting of the ad hoc committee will be March 10th at 7:30 p.m. via Zoom. Thanks.
Thank you, Mr. Mooring. And our last committee meeting report of the evening will be Mr. Lee and the Facilities and Purchasing Committee.
Thank you, Ms. Klein. This is a report of the Facilities and Purchasing Committee meeting from February 11th. The following items were reviewed and recommended for approval by the committee for presentation to the full board at tonight's meeting. We reviewed and recommended the list of district bills for approval. We reviewed the following contracts for approval: contract with CCIU for psychologist Jennifer Hetzke to provide student evaluation services, a contract with Cengage to provide digital access to the Voyages textbook currently used in global studies classes via their MindTap history product. Total cost of the 6-year contract is $188,160. We recommended the following items from the purchasing report for approval: $929,800 for the installation of a new traffic light and turning lanes at the site of the new middle school with low bidder Gessler Construction. $111,265.99 for a new hot water and pool heating system for Lower Merion High School from Avco Supply. $24,053 for a new fire alarm panel for Gladwin Elementary School from Siemens. 2 additional purchases from Siemens for building automation system controllers for Penwyn Elementary and Gladwin Elementary at a cost of $95,854 and $199,767 respectively. $1,032,100 to replace the roof at Kinwood Elementary with weatherproofing technologies. As we continue ongoing preparation for the reopening of schools, an additional purchase of 45 temporary shelters to be used at schools across the district to increase usable outdoor space from Amazon Capital Services at a total cost of $52,374.55. We recommended the following technology purchases for approval: $14,438.70 for the renewal of a software license with Smart Technologies interactive projectors and smartboards from Visual Sound. $9,607.35 for the purchase of 15 additional wireless access points to augment the wireless networks at district schools from Presidio Network Solutions. We recommended for approval an amendment with Interstate Maintenance to extend the contract for supplemental disinfection services an additional 6 months through June 30th, 2021 at a not to exceed amount of $275,000. We recommended for approval an agreement for a not to exceed amount of $25,500 with Wayne Moving and Storage for supplemental moving services to augment our reopening efforts. The supplemental services will allow the district to quickly replace furniture previously moved off-site for social distancing in classrooms. We recommended for approval the following contract amendments: an amendment to the contract with landscaping architects Glacken Thomas Panzak to include their updated hourly rate sheet, an amendment to the contract with Reynolds Energy Services to increase the scope of the bipolar ionization installations to include the auditoriums at Harriton and Lower Merion High Schools at a cost increase of $59,960, bringing the total project cost to $322,513. We recommended the following change orders for approval: a $0 change order with Watt Services to close out our site preparation project with them, a $35,000 change order with IMC Constructions for previously identified work related to changing the door key systems at the new middle school to make them compatible with other district schools. Lastly, we received a project update on the construction of the new middle school. Preliminary site work and blasting is complete, and work on the foundation and steel erection continues, with steel deliveries from the steel fabricator previously closed having resumed on January 25th. The next Facilities and Purchasing Committee meeting will be on Thursday, March 11th, 2021 at 8:30 a.m., presumably by Zoom. Thank you.
Thank you, Mr. Lee. We are now going to move on to our audience recognition part of the meeting. So at this time, we will allow 10 minutes for public comment on any topic. Mrs. LaPera will open the chat feature and you'll see a timer appear on the screen. Please start your comment with your full name and neighborhood within the district, such as Ardmore or Wynwood, so that your comment can be shared. This is very important that it has the name and neighborhood. These comments will be read by our solicitor, Mr. Roos, and as a reminder, public comment is limited to 1 comment per person. Ms. LaPera, thank you. Okay, welcome back, everyone. Thank you for taking the time to submit your public comment. Mr. Roos, can you please share tonight's comments?
I'm happy to. First one is from Gary Brandeis, who didn't put his residence or where he lives. So if he does that at some point in the meeting, I can go back to that comment. But same with Rachel McQuillan. Jen Kelly, Penn Valley, has a detailed facilities assessment been done at each school to determine the maximum distancing possible in each classroom if all hybrid students return full-time in person? And will that information be shared prior to families having to make a binding decision?
We are in the process. We have done it. We are in the process of refining it, and that would be part of the process.
Okay. Ellie Slomine, Penn Valley. I'm curious to know why the choice of attending 4 days is not available to middle schools, but it is to high school students. Also, when are you planning to have children with IEPs back full times?
I believe that there are some middle school students, again, on a case-by-case basis, who are in 4 days. Dr. McGowan, is that correct? Thank you.
Yes, that is correct.
Okay. One, Jennifer Hoffman, Marion Station. What equipment has been procured to maximize our outdoor spaces?
Right now, we have a series of outdoor tents for outdoor spaces.
Carrie Bryce, Marion Station. Can you please explain the reason for the 5-point decrease in 4th grade math benchmark testing relative to prior year?
I think it would probably be a good idea to take a look at that CCOB. I don't know that I can give a detailed explanation at this point in time in this meeting.
Katie Calabrese, Wynwood. Thanks for the committee reports, especially for Mr. Mooring. Really great work. I don't necessarily agree that community incidents should drive reopening decisions, but if incidence declines as predicted this spring, can the district please be prepared to move quickly to reopen schools full-time, particularly elementary? And please also set a goal to reopen fully by fall, even if it means securing portable classrooms or additional space so that distancing can be maintained. It is fine to hope for the best, but we also need to prepare accordingly to make full-time in-person education a top priority. Guy Cave, Wynwood. Educationalists in other developed countries have taken pride in keeping schools open as much as possible during the pandemic because they correctly see education as an essential service, understand the science, and realize how critical full-time in-person education is for children's well-being. Unfortunately, this school district has consistently undervalued the importance of in-person education in their considerations to the huge detriment of our children. Spring break is 6 weeks away. Why is there no urgency here, and why can schools not be fully open before spring break for those who want that option?
I think we've tried to speak to that issue in terms of making sure that we maintain the mitigation and also had the weather, quite frankly, so that we could make better use of outdoor space to increase distancing.
Katie Stellard, Bryn Mawr, given everything we've learned, why will it take 6 weeks to evaluate the survey and implement the plan, particularly for elementary? Neighboring districts are reviewing and implementing a return to in-person for ES much more quickly.
I've answered that.
Okay. Next is a repeat comment. Alejandra Cordebo, Bala Kinwood, could you provide a timeline of the full opening of schools and why no plans or actions have been taken more proactively to prepare and don't lose more time when schools can't be open?
I gave a timeline in the beginning of the presentation. I'll repeat it at this point. We're taking a week to look at the analysis of the results of the survey. We will then come back the week of the 8th and be able to have some sessions where schools can take parents through the details of what it would look like in their buildings, and then ask for final commitments towards the middle of March with an expectation of a full target of getting things in place during spring break for a return right after that. That's our target. Some things may happen before then.
Larry Ward, Bala Kinwood. Given that the parent survey is non-binding and actual in-person enrollment will be determined later, and the fact that community virus prevalence will continue to change and likely decrease substantially, why is it going to take 6 weeks to reopen in-person instruction for those who want it, especially at the elementary school level, but up through high school also? Katie Daly from Penn Valley. Many nearby districts have offered a full-time in-person option for several months, some since last September. Radnor is offering a full-time in-person option starting in just a couple of weeks. We've had over a year to be prepared with Lower Merion School District's full-time in-person option. Why doesn't the best funded district in the state have a full-time in-person option already available? Our students cannot suffer any longer. 6 more weeks to make a plan is unacceptable. The target return date of the fall is unacceptable. Our students deserve significantly more urgency.
We're not in a race with other school districts. We are in a race to do the right thing given our particular set of circumstances. Not every district is the same. Some districts are able to provide space. We have a growing enrollment. We have difficulty in dedensifying. And so we're moving at a pace we think is safe, but also sound.
Christina Chang, Penn Valley. Thank you for inviting Dr. Rubin to join the board meeting this evening. Well, Dr. Rubin seemed to dismiss Bucks County, right here in Montgomery County, Methacton, Souderton, Springford, Upper Dublin, Upper Merion, Wissahickon, and starting Monday, North Penn will be open 4 or 5 full days in person for elementary. How can we dismiss these local Montgomery County districts and plan for a reopening for our youngest learners over 8 weeks away from spring break? That seems like we are not acting swiftly enough. Our youngest are missing out the most, behind in reading and math. Can we act more urgently to get these students in the classroom in person 5 days sooner? Please take this into consideration. Thank you.
Spring breaks in about 5 weeks, I think, but we're moving as swiftly as we can.
Olivia Thompson, Bryn Mawr. Depending on what we learn about the expanded summer programs, is it fair to charge families for the expanded summer programs for learning losses or lack of full-time instruction during the school year?
So we do this time every year. We did it the last year at about this time, and then when it came time for the summer program, once it was developed, it was offered free of charge to families. That very well may be something the board does going forward, but this is a procedural process.
Evan Moscow, Penn Valley. Does the school board acknowledge at all the detrimental effect that 1 year to 18 months out of in-person school will have on these kids moving forward, both educationally and emotionally, or is this not even considered by the board?
Of course it's considered. This is the exact reason why we've been trying to get as students in as much as we can. We put a plan in place to make sure that kindergarten, for instance, while it's a half-day kindergarten program, as it always has been in Lower Merion, has operated since the beginning of the year on a 5-day-a-week process. And it's the reason why our special needs students have been in since I think late in September, and it's the reason why we're moving as quickly as we can to have our hybrid program, which we think, while not perfect, has made the best use of the time that we could have had.
Carrie Pastronk, Gladwin. How does Lower Merion School District justify remaining hybrid when other neighboring school districts return to in-person? What, quote, out of the box, end quote, measures will Lmsb enact to provide full-time in-person education? such as utilizing outdoor space, creatively spacing classrooms, and implementing other CDC protocol to allow our children to receive an actual education. Kate Legge, Winwood, why are we waiting until April to send back the elementary kids' schools? Other school districts have already moved in that direction. What could be changing between now and April that would be substantial change? At this point, the information we have shows that the benefit of full-time in-person education outweighs the risks. Katie O'Gara, Ardmore, what are you doing differently now as opposed to a year ago that will help parents feel confident that plans are being made and actions are being taken to ensure we have a detailed, thorough, yet flexible plan in place well before the end of summer? This year has been so haphazard, not entirely the fault of the board, and we entered into it with so much hope after what we assumed was a summer of planning. Parents want to feel comfortable making decisions that are best for their families without worrying about future changing metrics or lack of sufficient decision-making time.
One of the things that came through with Dr. Rubin's presentation is that we've tried to adapt given changing guidance and changing circumstances. Initially, my gosh, 3 weeks ago, we were very concerned about the variants. As you heard tonight, he's given us some support that the variants may not be as detrimental as we thought a month ago. So we've all tried to move with as much flexibility as we possibly can.
Heather Pasqualino, Winwood, how long will it take to turn around the survey results, determine next steps, and act on them?
About a week.
Jasmine Evans, Winwood, Penwyn, when will the tents be available for use, and what is the plan for how they will be distributed? Does each school get 4.5 tents, or will they go to the schools with the most crowding?
So our operations department has worked with the principal on where to position the tents. They should be here within a week or so, but obviously they won't be used until they're not load-bearing or snow-bearing tents. They're designed to be used in warmer weather.
Hugh Ehrenberg, Penn Valley. I feel like there is a momentum building towards a full reopen, and this is welcome. I fear we will continue to be reactive rather than implementing a plan once some yet to be defined watershed is reached. Please reassure those who have waited in hybrid with no palatable option that there will be an actual plan ready before it is needed. The learning on the fly stage of this has long since passed. Barbara Schotener, Narberth. Schools need to be open for 5 days of in-person learning. Long Island schools have been open with 3 feet and plexiglass in September for elementary, middle, and high school. Our kids will have lost over a year of learning. Fridays are basically 3-day weekends every week. Please give parents the option to choose full-time in-person instruction for their children. The kids light up when they go and come from school, and the school year is ending soon. Thank you. Catherine Jordan, Narberth. The high school guidance counselors have been considering 4-day week requests on a case-by-case basis. I applaud them for their efforts, but it has raised concerns about equity. Given the current high school enrollment and the attendance for hybrid, can the district make access to this option more equitable and widely share information about how to make this request?
I think again, the concept is making this available to students who need it, and that's the equitable. Just as we do extra reading help, extra math help, tutoring, various areas that we make decisions, special needs help because of the needs of students in their learning.
Okay. Jen Brasso Gladwin. Despite the decreases in cases, Dr. Rubin's supportive in-person and all the protocols Lmsd has put in place, the timeline for return to in-person instruction is still targeted for after spring break. Plans won't be announced until March 15th. Why so long? This is too slow of a timeline. Once the results of the survey are received and assessed, it should be a priority to act swiftly to get those students back in school full-time for those that want or need it. Please put an accelerated timeline in place. It is critical for our children, and the evidence supports it can be done now. Please confirm that accelerating the timeline will be considered. Lisa Maslow, Bala Kinwood. Can you please clarify how lunches will be handled in the upper grades if the district goes to a full reopening?
Again, that's a thing that the principals are working on, and when they have their separate sessions, they can speak to the specifics of that.
Title BU has submitted some comments, but hasn't said a name or location. From Amanda Beeler Winwood. I hope the board, so if they could submit that in chat, we could read their comment. Amanda Beeler Winwood. I hope the board and administration will continue to work diligently to have plans in place to open schools, including high school, to the fullest capacity possible before the school year is over, and to plan now and commit to full in-person learning with masks at the beginning of the school year this fall. I recognize that distancing is the biggest hurdle in high school to getting students back in person, but the current hybrid model means classes have 2 to 3 students in them each day. Sadly, many hybrid students opt to stay home on quiz and test days as it is much easier to cheat. SU teachers seem to just now be trying to curb and manage in earnest. There is definitely space for more children in high school classrooms. Options to opt in to 4-day-a-week in person need to be codified and shared with parents, not just on Facebook groups.
The high school, it is true that our high school enrollments are down, and that was a place we had hoped to move quickly on bringing students in, even though, you know, the trend is to try and work with elementary. But when you look at individual classes, it is true some classes have 2 or 3 students, other classes do not. And the ability to stay 6 feet apart is even harder if you're going to have 18 or 19 students in a class. But we believe that we'll get some good information with the survey.
Next, Ursina Teitelbaum, Ardmore. Dr. Rubin's discussions of trends are very encouraging. I'm struck by how many local districts, including larger ones, are moving forward with more accelerated reopening plans, despite the middle of the road CDC guidelines. I think those guidelines clearly had to take into account less resourced school districts nationally. I have always thought that our facilities improvements were exemplary. When I read about the air ventilation exchange per hour, it is much better than current and future hospital of the University of Pennsylvania, but now I'm worried somehow we aren't prepared enough compared to our local counterparts. I can really find no other explanation for the inequity compared to our quote peers, end quote. Can you list improvements that would expedite the timeline and where we are with them?
Not beyond what I've said.
Next to Linda Donahoe, Bryn Mawr. This evening's meeting has been very informative, helpful, and promising. However, I feel that we need to figure out how to accommodate the high school students who want to return to 5 days in person as soon as possible. Testing and tents are not new strategies to bring students on campus. Many private schools have been using these exact strategies since the fall. LMSD should be using them too. Finally, I want to share with the board that I am very concerned about the LMSD's timeline. I want to be sure that we have a good sense of when we will know our next steps. Nancy Polychronopoulou, Balakinwood. It seems like it is time to admit that based on CDC's recommendation, 6-foot distance is non-negotiable for the immediate future, and we have no way of knowing how the fall will be like. The only logical plan is to open schools with the 6 feet distance in place. We need to start putting specific plans in place for each of the schools. Otherwise, the fall will be here shortly and find Lower Merion School District unprepared once again. Although middle and school and high school may be more complicated and require more planning, elementary schools should be able to achieve this goal. The idea of pods or cohorts has been mentioned before, but I'm wondering what is stopping us from implementing it. What is stopping us from maintaining the 2 cohorts as they are today and alternate the time they spend in the classroom? For example, while cohort 1 is working in the classroom, cohort 2 is on a different room working on daily specials. Then, while cohort 2 is working in the classroom, cohort 1 is outside for recess, etc. The separation and some imagination when planning will allow us to maintain the 6 feet distancing and separates children in cohorts, limiting close contacts. For lunch, a simpler approach can be used, eating in the classroom, maintaining the 6 feet again, and alternating cohorts. Outdoor spaces for additional seating have been used in many schools, and they are proven to work. We may need a solid reopening plan, a plan that can be achieved now and will be able to be applied in the fall, no matter what happens with everything else.
So that's similar to what we did with kindergarten. When our kindergarten numbers exceeded the 6 foot, we were able to, well, let's say there were 3 students who were over the limit, we were able to use staff to circulate students in and out of the classroom all day long so that you never had more than the required number of students. We don't have, when you're looking at an entire school, you don't necessarily have that much swing space, nor do we always have the staff that we need. So right now we're down on the number of staff who we normally use to supervise students during recess. We're looking at enhancing our abilities by working with Right at School to see if they have some of those folks that they can use during the day, so that we might be able to use swing space. And obviously, if there's going to be swing space that's going to be used outdoors, we need temperature change on a more regular basis.
Bridget Toole, Wynwood. I asked a different question, but Marple is voting next Tuesday to going back approximately March 9th with 2 weeks turnaround. Radnor is going back March 1st. Why do we need, quote, at least, unquote, 6 weeks to plan and prepare? Stephanie Ingersoll, Bryn Mawr. Assuming the survey results come back overwhelmingly in favor of full-day in-person instruction in our elementary schools, are you in communication with similar neighboring districts like Radnor, which plan to implement full-day instruction in just a couple of weeks to learn from each other, and how quickly could we transition to full-day schedule?
We're in communication with other school districts, and we find that in many cases they are able to provide the distancing that we aren't. And in some cases, we're able to provide some services in some situations that they are not. So yes, we're in constant contact with other districts as they are with us.
I'd like to jump in. I'm sorry. I'm going to jump in as well. I know that Mr. Copeland is on twice weekly calls with the other Montgomery County superintendents and other districts. I just wanted to add that on the board level, I'm also on weekly calls with other school board leaders in the area and across the state. So there is a lot of communication and coordination going on, both at the administrative level and the board level.
Heather Pearson, Penn Win. When will we see an actual plan to implement full-time in-person instruction? Letty Switzer, Belmont Hills. I encourage you to bring back elementary mid-March. What concrete steps can we count on next week when you have the survey data, such as ordering of tents, ordering of return of school furniture, upping number of tents per week, etc.? Amy Clipson, Bryn Mawr. While it is great news that LM is moving forward to try to reopen schools fully, I find it extremely disappointing that we are not considering this until after spring break. I would ask the school district to move up the timetable for in-person schooling. Schools all around us and throughout the country are open for in-person learning. Why not for Lower Merion? Hybrid learning has been woefully inadequate for my children. 1 year later, it is time to give those of us who want the option to have our kids in full in-person school. Diane Rogovich, Marion Station. Mr. Copeland and the board, our schools must reopen fully for in-person education as soon as possible, especially for elementary school students. Please consider shortening the timeline, bringing the students back as soon as possible. The stress that has been caused by this prolonged closure of full in-person learning is indescribable, both for the parents and the children. We must take every possible measure to get the kids back to school as soon as possible and remain open fully. Christina Hahn, Bryn Mawr. 1, when do we expect more rapid testing? When do we expect to expand more rapid testing to the student population? Can we allocate funds to purchase them if CHOP will not increase our allocation? 2, when will 45 tents arrive? Can kids eat lunch plus receive some instruction outdoors when weather permits? 3, what type of planning is concurrently happening for the fall? 4, will LM at Home be offered in the fall with more flexibility?
So in terms of the fall, we fully expect that there's going to be some virtual program that we're going to be putting in place for the fall because people will not be comfortable. That's going to be determined based on our planning, the late spring, early summer, and where we are at that particular point in time. I think I've answered the questions about the tents. In terms of the testing, Dr. Rubin assures us that we will have all of the testing for students that we need.
Last comment is from Dominic Pasqualino, Wynwood. We will never eliminate all risks. At some point, we need to return to in-person school as hybrid is not adequate. That concludes the public comment.
Thank you very much, Mr. Roos. So now we're going to move on to the next part of our agenda, which is I'd like to approve tonight's agenda via consent. So first I'll ask if there are any questions from the board. I did want to ask Mr. Copeland to speak to, and we already did a little bit, but again, speak to the concept of the summer programming and why it's on the agenda at this point.
Yeah, this is just a sort of a normal timing situation for the normal summer programs that we offer during the summer. And last summer, the administration came to the board at the end of the summer and asked for a waiver of all both the typical summer program as well as the virtual program that we did during the summer, and the board accepted that recommendation. So this is pro forma, and the board can make that decision at the time.
Great. Thank you very much. Are there any other questions? Okay. So do I have a motion to approve tonight's agenda as a consent agenda?
So moved.
Do I have a second?
Second.
Second.
All in favor?
Aye.
Aye.
Aye. Okay. All opposed? Any abstentions? Great. Motion passes. Mr. Roos, can you please give us an update report on the Sunshine Act?
Yes, the board held executive sessions on February 8th and also February 16th, this today. Both times the basis for the executive session was land use litigation.
Thank you. And Ms. LaPera, can you please share our upcoming meeting dates?
Yes, we have our board meeting dates. March 8th is the Education Committee and Supplementary Regular Board Meeting. And March 15th is the regular business board meeting. Both of those are at 8 p.m. And then our committee meetings all start at 8:30, except for when I say they don't. March 3rd is the curriculum. March 5th is policy. March 10th is the ad hoc equity and anti-racism at 7 p.m. March 11th is the facilities and purchasing. March 17th is communications, also at 7 p.m. March 24th is the first of our budget review finance meetings, and that will be the operations budget review. And then March 25th, we've added in the legislation committee meeting on it's a legislative forum, and that's also at 7 p.m.
Thank you, Ms. LaPera. So as I say every meeting, I'd like to invite everyone and encourage you all to participate in the board committee meetings, as they're a really great way to be part of the more detailed work of the board in a less formal setting. I'd also like to remind everyone of some upcoming parent events. This Thursday, February 18th, is a student services event titled Permission to Pause, where the district's school social workers will share information on helpful stress reduction techniques and community supports available for our students and families to access. On Wednesday, March 3rd, the Interschool Council and the Health Services Department have a parent education series, and along with the Walsh Valley HSA, invite the community to a conversation about LGBTQ+ students and isolation. That'll be facilitated by Dr. Jeannie Stanley. Finally, the Committee for Special Education is partnering with similar partner organizations in Radnor, TE, and Methacton school districts for a 4-part education series focused on advancing inclusion in our schools. The third of the 4 sessions is tomorrow, March 17th at 6 p.m. And information on each of these events can be found in your school's HSA newsletters. And before ending our meeting, on behalf of the Lower Merion Board of School Directors, I'd like to express our condolences to the family, friends, and colleagues of Michael Stettner, a beloved Lower Merion High School science teacher. Not only did Mike love his students and find great joy in coaching the Science Olympiad team, he was an invaluable leader in the Lower Merion Education Association, serving for nearly 30 years in elected positions. Mike was dignified, respectful, and a friend to all, and he will be sorely missed within the school district. Yes?
I apologize. I apparently missed the first page of comments. So I'd like to be able to go back.
Yes, absolutely. Let's go back.
Okay. There's just a handful. Navnet, Miller, Gladwin. Will the board prioritize the well-being of our children and utilize the data from schools around the world showing it's possible to have full in-person instruction without negative consequences? We are lagging behind neighboring schools, and the only people who are being hurt are our children. I implore the board to return our schools to school full-time, particularly our youngest learners. Also, we need to plan for full in-person instruction in the fall now. We're behind on that as it is, and need to step on the accelerator so we don't lose another educational year. Next is Cynthia Jacobstein-Narberth. There is limited information publicly shared with respect to how the district performs contact tracing and then characterizes exposure determination as in school versus outside school versus unknown. There are 256 COVID cases documented on the Lmsb dashboard as of 2/12/21. Can you enumerate specifically how many of the 256 cases were deemed to be in school exposure versus external to school exposure versus unknown?
Harry, can you talk a little bit about our contact tracing?
Sure. Each case is investigated by our team of nurses, and that includes contacting the family, who oftentimes have information as to where the child may have gotten COVID, whether that be from another family member or a babysitter or an activity. We speak with teachers, principal if necessary, transportation regarding whether they travel on the bus or they carpool. So each case is investigated thoroughly, and it is communicated with the Office of Public Health.
And that's communicated in the letter that goes home?
Yes, whether it's, and every case is reported home for the school where the case occurred, and it identifies whether it was school-linked transmission or out-of-school transmission. And to date, we have very little, if any, in-school transmission. We have a lot of transmission that can be identified or tied to outside activities and so forth, but we're limited with our investigation of that. The health department takes that apart on, and we work on the in-school transmission.
Thank you.
Mm-hmm.
Peter Spolderich, Haverford. While Dr. Rubin and Mr. Copeland have been very optimistic about our ability to be fully in person in September, Dr. Rubin did note that it is not possible to confidently predict our conditions that far ahead. With that in mind, it is imperative that the district establish and widely communicate plans for multiple contingencies for next school year, starting now and continuing throughout the summer. Last August and September, we were caught flat-footed, and many of us fear that the district will be caught again making overly rosy assumptions that could prevent us from maximizing in-person time for our kids. Please commit now to sharing specific plans for next school year with the community. Next, Andrew Thompson, Bryn Mawr. How long will it take for the school administration to determine next steps? Mark Fasano, Wynwood. Mr. Copeland, is the district paying Dr. Rubin?
Dr. Rubin gets no remuneration from the district.
Gary Brandeis, Villanova. What is the plan for seniors to get back into the schools for some recognition of finishing their education at Lower Merion? Our seniors have not had sense of their last year, and school district owes them a chance to connect with their classmates before they move on.
I can tell you that administrators are working with students, HSAs, and activity sponsors on end-of-year activities such as prom and graduation as we speak.
The last comment is Rachel McQuillan, Bala Kinwood. Given the many medical experts on COVID, why has the district not used a more diverse panel?
We actually used the panel, the entire panel from CHOP, and we've worked with not only Dr. Rubin, I've also attended sessions with Dr. Coffin and Dr. Offit.
Sorry, I did find one more. Ruth Jenkin, Wynwood. Will the integrated student-driven curriculum used in math be applied to language arts and science? How will the teachers be coached on this approach?
This is a math-specific curriculum.
All right. We are now finished. Sorry about that.
Thank you, Mr. Roos. I would like to sort of, as we close the meeting, we are just about done. I do want to add that there, as happened last summer, that there was a lot of planning around sort of what the different contingencies were, whether it was fully open, whether it would be a hybrid program, or whether it was fully virtual. So that planning did occur last summer going into the last school year. And as we work towards planning reopening for the spring, that work will continue through and over the summer to provide a variety of contingencies and options for the fall as well. So thank you all very much for your time this evening. And since there is no further business, the meeting is adjourned. Have a nice evening.